It is Sunday morning in Macon County, Tennessee, a poor white area of the southern United States. Despite a tornado warning, people have traveled hundreds of kilometers in the night to get here. Dozens of volunteers are preparing for the huge task ahead. Many of the patients have waited years for a medical exam. Today they have a free one. This is the first time the aid organisation Remote Area Medical has come to this part of the volunteer state. Seat numbers are given out.
I have my eyes checked and have some teeth taken out.
The organisation's founder lands his private C-47 Stan Brock. By profession, he is an actor, famous in the US for the film series Wild Kingdom. But at heart, he is an adventurer, having spent his early years in the South American rainforest.
Where I grew up, down in the Amazon, we were 26 days on foot from the nearest healthcare. So I used to go to town, walk through the jungle there. So originally, Remote Area Medical was founded to take airborne relief to the Amazon. And then people started inviting us to look at pockets of poverty here in the United States. And the next thing we knew, we had a bigger problem here than we've got in the Amazon. And so now 60% of all of the work we do is right here in the United States, the world's richest country.
14.
6 a.m. and the clinic opens its doors. The chief calls numbers one by one.
15. Here we go. 16.
Of the 50 million legal US citizens living in America today, 1 in 6 of them are without health insurance, and this number is increasing.
I see in the World Health Organization listings that the United States is number 37 in the world in terms of healthcare. France, I believe, is number 1. And so why is the richest country in the world so low down in the ratings? And of course the reason for that is that a huge percentage of the people in this country don't have access to it.
The US spends more money on healthcare than any other country. And yet it is the only industrialized nation without a system of general health insurance. Sandy is one of the 50 million without. She had private health insurance for years. But after 3 operations on her back and being diagnosed with leukemia, her premium jumped from $1,500 to $10,000 a month. An exorbitant amount for a mother of 3.
This is a problem that affects blacks and whites and Asians. It affects the rich and the poor. This isn't a poor man's problem. I'm not poor. I'm an average middle-class American. Every American is one diagnosis away from being exactly where I am. If they get one diagnosis, their insurance company bumps them off.
10 years ago, Sandy's whole family was privately covered. In the meantime, her and her husband have lost every penny of their savings to medical expenses.
We basically began selling things. We sold our cars and furniture, used all our investments. College funds were all wiped out to try to keep me in chemotherapy.
General health insurance has always been a highly contested political issue in America. During the Second World War, few companies offered healthcare programs to their employees. 1965 saw the establishment of general health insurance by President Johnson. But this was limited to seniors and those receiving welfare benefits. At the beginning of the 70s, President Nixon resisted lobbying by doctors and pharmaceuticals. When it came down to a vote in Congress, a bill to put through a system of general healthcare insurance was rejected. Back in Macon County, the local school is turned into a hospital for 2 days.
patients are generally people who have no health insurance or dental insurance. Generally, it's the working poor. Most of these people are employed.
The biggest crowd is gathered in the gym. The dentists are hard at work. Patients wait for hours before they are seen, but this is a short period of time for those who have been in pain for several months.
It's pain waking up in the middle of the night with toothaches and stuff, so I might as well go ahead and have them pulled out.
The doctors who volunteer for the organisation are responsible for all their own costs. They pay their petrol, accommodation and food, and they give up their weekend to work for free. This dentist drove for 10 hours to get here, but for him the journey is more than worthwhile.
These people are so nice. They really appreciate, but we get more than they do. The giver always gets more than the receiver, and they keep thanking us, but we're getting more than they are, so.
The mobile hospital cannot offer operations, but it provides vital services to those who cannot otherwise afford them. Mammograms, scans, dental treatment, and new glasses.
I drive a truck, and at night I can't see out my left eye hardly at all. So.
That's dangerous to drive a truck.
Sure.
The fear of falling ill is a heavy burden for many. Half of all private bankruptcies in the US are caused by extortionate hospital bills and doctors' fees. 3/4 of these are in the early stages of an illness, the result of sharp hikes in insurance premiums on diagnosis. Hospitals are obligated to treat emergency cases, but more often than not, the patients cannot afford to pay the bill at the end of it all.
I really hate to say this, but if you don't have insurance, they're hesitant to open the door for you. I mean, and that's tough. And then, on the other hand, I hate to make a bill that I can't pay. So therefore, if you think you can't pay it, you're not going to go to the doctor.
The United States needs some kind of health plan that covers everybody in the United States.
In order to pay doctors' fees, Sandy has taken a second job as a broker. In the US, when the state fails to help, people have been seen to show incredible generosity. A few months ago, Sandy's friends who run a charity donated $40,000 US, which helped 2 patients pay for their chemotherapy.
Our healthcare crisis in America has nothing to do with money. I can prove it to you. We have a multi-billion-dollar pet industry. We spend multi-billions on pets. There are people who have health care for their dog, but I don't have health care.
The patients give their thanks to the organisation's founder. Over the weekend, 549 people have been examined. 56 mammograms were performed, 222 pairs of glasses made, and 416 teeth pulled. It was the 537th stop of the remote area medical organisation.